Welcome to today's session. In today's session, we are going to look at the nursing care plan for prematurity. Basically, the problems we are going to identify in this nursing care plan can also work in other premature emergencies like asphyxia or respiratory distress syndrome. So we'll go straight to the possible problems that can be identified in prematurity. Of course, the first problem that we can see is ineffective breathing pattern. Now, when it comes to a nursing care plan, it is very important that you prioritize the problems, meaning the problems that are cardinal should be put as first problems. Then the problems that are less cardinal should be put as last problems. And of course, you should always end with the risk problems or potential problems that have not yet occurred. Now, when it comes to the first problem, we are saying ineffective breathing pattern. The nursing diagnosis should always be related to something and with always an evidence. So in this case, we are saying ineffective breathing pattern related to immature lungs, evidenced by cyanosis. Then you can, of course, phrase your objective or your goal depending on which English you feel comfortable with. So in terms of the objective, you can say to improve the breathing pattern within 30 minutes of nursing intervention. Or if you are using goals, you can say the baby will have normal breathing pattern within 30 minutes of nursing intervention. So whichever one is still okay. In terms of intervention, you can say I'll place the baby in a lateral position to aid drainage of secretions and prevent aspiration. Apart from that, you can say I will clear the airway using a penguin sucker to promote the patent airway. You can also talk of administering oxygen 1 liter per minute to promote tissue perfusion or respiration. You can talk about avoiding placing food in the mouth of the baby to prevent vomiting or choking. Basically, here in terms of food, you're avoiding breastfeeding the baby immediately, as that may cause choking. Then other interventions, of course, may also apply, such as giving air using an ambio bag. This will promote lung perfusion. In terms of evaluation, you can say the baby's breathing pattern improved within 30 minutes of nursing intervention, evidenced by absence of cyanosis. Another problem that we can see is altered thermoregulation. And altered thermoregulation in terms of the nursing diagnosis is related to underdeveloped heat centers or lack of adequate adipose tissue, evidenced by a temperature of 35 degrees Celsius. In terms of the goal, you can say the baby will be relieved of hypothermia within 1 hour of nursing intervention. Then, of course, some interventions include nursing the baby in an incubator. Remember, the intervention should always have a reason. Covering the baby with adequate linen, switching on the heater, also changing any soiled linen. Those are some of the interventions that we can put. Then in terms of evaluation, you can say the baby was relieved from hypothermia within 1 hour of nursing intervention, evidenced by normal body temperature of 36.5 degrees Celsius. Other problems that we can see includes risk for imbalanced nutritional status, and risk for imbalanced nutrition status less than the body requirement is related to poor sucking and swallowing reflex that we see in newborn babies, especially premature babies. And in terms of the goal, you can say the baby will have adequate nutritional status throughout hospitalization. In terms of intervention, you can talk about assessing the ability of the baby to suck, and this will determine appropriate feeding method. Then apart from that, you can say if the baby is unable to suck or swallow, I will insert an nasogastric tube as an alternative way of feeding. You can talk about checking the blood sugar levels to rule out hypoglycemia, and of course you can talk about giving expressed breast milk using a nasogastric tube. Then of course, in terms of the evaluation, you can say the baby's nutritional status promoted throughout hospitalization, evidenced by presence of weight gain. The other problem that we can see, which is risk for infection, and risk for infection is related to immature immunity. In terms of the goal, you can say the baby will be prevented from infections throughout hospitalization. Then in terms of interventions that can be done, of course, washing hands before attending to the baby, minimizing visitations, also not allowing staff or people with respiratory infections to enter the nursery. This will help prevent transmission of infection. Also, incubator care, this will promote hygiene and prevent infections. Apart from that, administering antibiotics, prophylactic antibiotics, to prevent infections, of course. In terms of evaluation, you can say the baby has been prevented from infection throughout hospitalization, evidenced by a temperature of 6.5 degrees Celsius. Then the last problem that we can see is risk for fluid volume deficit, and also risk for fluid volume deficit is related to poor suckling and swallowing reflex. In terms of the goal, you can say the baby will have adequate fluid volume throughout hospitalization, and of course, in terms of intervention, you can talk about if the baby is unable to suck, you can insert a nasogastric tube. You can also encourage the mother to exclusively breastfeed the child. This will promote the fluid volume. You can also give IV fluids like normal saline 5 ml per kg body weight to improve circulation and promote the fluid volume. You can give dextrose also to promote energy. In terms of the evaluation, you can say the baby's fluid volume was promoted throughout hospitalization, evidenced by absence of poor skin turgor. So in terms of the nursing care plan for prematurity, asphyxia, including RDS, these are some of the problems that we can see. Always remember that when it comes to evaluation, even if the problem is you should always have the evidence there. Even if the problem is just a risk problem on evaluation, the evidence must be there. The grading system is that you get a mark for a correct problem, then 2 marks for correct nursing diagnosis. You get a mark also for correct objectives. You get 4 marks for 4 interventions, and 2 marks for a correct evaluation. So when you complete your problems like this, hence one problem, you're able to get 10 marks. Then out of the 5 problems, you end up getting 50 marks in the exam. So that is how you can write the nursing care plan for prematurity, asphyxia, or RDS. So this is where we end today. Till next time, goodbye.